The vertigo first started back in 2020, but it was very infrequent, very spinny, you know, like I'm off balance and you just don't feel right. They last anywhere from 5 to 17 hours. They're always a 10, you know, or at least it feels like a 10. The last week, it's been pretty consistent every day. Not full spinning, but just off balance and just not great at walking a straight line, if that makes sense. This is the first day that I've had full-blown like spins and vertigo, I'd say in 2.5 weeks. And it was just very mild between the last attack and then this attack. They diagnosed me with Meniere's disease. Originally how this all started is I had a lot of, you know, pain and pressure and noise. I hadn't had the pain in my ear yet, so I went to the ENT, many ENTs, and the first one said I had eustachian tube dysfunction because the eardrum was very retracted in, and actually I had the problem on both sides. My right side cleared up, my left ear never did. They did MRIs and find tumors. My VNGs and my Meniere's tests, which is interesting, were what they called borderline abnormal. They were right on that edge. So he still diagnosed me with the Meniere's disease. It's so loud, like, to give you perspective, you go to a movie theater and I hear this over the movie. I hear it over a lawnmower. I hear it over a vacuum. It's like finding the worst static station on the radio and turning it full blast. It started off initially sporadically, and then it has been constant since beginning of 2020. It hasn't really eased up. It does change with my jaw movement. So if I yawn or open my mouth really wide, believe it or not, it gets even louder. My left side's louder than my right, 10. So the ear pain started later. It really got bad after my jaw locked shut. It'd be so sharp that sometimes it would even just drop me to my knees. As things got worse, my ear pain then kind of became like a dull pain, but then I'd get the shooting sharp pains on top of it. And then eventually my right side started having the pain as well. It wasn't as frequent and it wasn't as sharp as my left side, but unfortunately ended up then having to deal with it in both ears. The last few months, I really haven't had anything in my right ear that has improved. My left ear has improved too since August, but it's in the last few weeks, it's getting worse again, and I'm having it probably at least every 2 days. I have 1 to 2 really sharp pains that just are uncomfortable. 10, and they last probably, I would say maybe like 5 to 10 seconds. It seems unpredictable initially, but I get more of them in the evenings. It seems like after like a long day of talking or using my jaw, my ear pain seems to be more frequent. Again, they got worse as my jaw got worse, and they come on and they kind of start, they're worse on my left side around my left temple, and then it kind of shifts over and behind my eye, and then eventually it'll just kind of cover the front of my forehead. Every once in a while I do get a sharp headache in the back of my head, kind of like at the top of my, bottom of my skull, top of my spine. And originally they came and they were always seemed to be worse in the morning. And then as things progressed, they just became daily. The pain range can go anywhere from, I'd say, a 6 all the way up to a 10. Just depends on the day, but it's always there. I've had jaw issues and popping. I remember in my 20s, I mean, even my dentist had mentioned it back then, and every dentist I've ever seen from that point on has mentioned it, but they never said it was a big deal. You know, it's just popping. I wasn't having any issues, so they're like, don't worry about it. It definitely didn't end up being okay. I always had issues with it. Tightness, pain, clicking, locking. Initially, before it got its worst, it locked open for 2 hours. That was December 2021. I had went to the chiropractor, who was the one that actually told me that I had jaw issues. And he had recommended I go over to and see an acupuncturist to help, with it and relax everything. And when he stuck the needles in, it was extremely painful. My ear noise got 1,000 times louder. And that's after he had taken the needles out, was when my mouth then just locked open. I opened my mouth to say something and it locked open. Beginning of January of 2022, all of a sudden I was talking and it moved my jaw, and it locked shut, and it locked shut at 15 millimeters, so I couldn't even open it wide enough to brush my teeth. It was horrible, and extreme pain, just horrible pain. And it just got worse from there. I swelled. If you saw pictures of me, I was unrecognizable. I just swelled up completely. This was before surgery and after surgery too. So the first one was in April. At that one they did, I think it was an arthrocentesis, where they didn't fix anything in the joint. They just went in and cleaned it out and then put some steroids in, and then they were hoping that that would be enough to allow me to open my mouth and calm things down, which it didn't. I will say the steroid helped. Once the steroid went in, it did help with the vertigo too, which was nice, but it didn't fix the problem. And so they did an MRI, and they saw, on there I had the internal derangement on both sides. And so I had seen a few TMJ doctors. I wouldn't call them that, but they claimed to be. The one ended up just telling me, well, this is a surgical issue. There's nothing I can do. So thinking that was what my answer was. I look back on it now, I wish I would have never done them, because they were the worst surgeries I've ever done in my entire life. So I had in June the discs removed, and they did a full open joint, so they cut you from here all the way down to here. I was so swollen again, you couldn't even see my ears. It hurt so horribly bad. I had vertigo with it every single day after surgery for 2 weeks. And they ended up diagnosing me with double ear infection, because they were all red and I was having horrible vertigo. I was one of 2 of the surgeon's patients that has ever had this happen in 10 years. So I had an allergic reaction to the silastic membrane. And so they did like an emergency surgery that following week. After they did that, I should regain full range of motion of my mouth, and it's now January of 2023, and I still can no longer open it any further than the additional 10 millimeters that I got post the June surgery. The next step, of course, would be another surgery. That, or they recommended maybe trying Botox in the muscles of my face. I still get locked shut. Resting, it's a dull ache and like a dull tightness. Always hovers around probably a 3-4, pain. It feels sometimes like it's pulling on my ear or pulling back into my ear canal. But the pain is all right in the joint. When I open my mouth, or if I chew anything harder or more resistant, that I basically am on a diet that's either a smoothie or I can mash with my tongue. If I chew anything harder than that, or I open my mouth far, it's easily an 8-9 pain level. My symptom flares coincide with what's going on with my jaw, and I just wish I would have found someone knowledgeable enough prior to the surgeries, because it's gotten worse since I did the surgeries. I'm actually feeling much better compared to where I was last Monday. I've seen an improvement in my vertigo. It initially I don't know if spiked is the best word to say right after the orthotic was in, but it stayed pretty much the same, but the intensity was a little bit less. And normally I feel a little drunk or off balance after the episodes, and this was the first time that once it was done, I was steady on my feet. So I've seen at least a 30% improvement, I would say, just within this first week. Last time I had my eyes closed and sitting down because I was in the middle of a Vertigo episode. So like I said, much improved since last Monday. And Vertigo wasn't the only thing. My second one was the tinnitus, which is, like I said before, it's so loud. Like you can sit in a movie theater and hear it over that. You can hear it over a lawnmower. And I've seen an improvement in that as well. I'd say about 15%, 20% sometimes, depending on the day. But it never, before, you know, it just was roaring all the time. And the pitches changed some too. So before it was more of a white static noise. Now it's still static, but it's more of a high-pitched static. So that has changed as well, which is a lot more tolerable than the noise that it was before. I still have the ear pain. It's not as frequent and it's not as sharp and debilitating as it was before. When I would get it, it was very, very painful. So now it's more like just a mild pinch is probably what I would equate it to, and not as frequent. So that has been improvement as well, which I'm very happy about. I would have to say it's probably at least a 50% improvement. The headaches are probably my best improvement. So before, my headaches were constant. I'd wake up in the morning, I'd have them all day, and it greatly affected my function. And so now my headaches, I wake up in the morning, I feel good. And if I do get a headache, it lasts maybe an hour or two, and then it goes away. And so that's been a huge improvement. I'd say at least a 70–80% improvement in my headaches. And it's just allowed me to function a lot better, you know, during the day. So I'm very, very happy with that. At rest, the pain has improved. I still have the limited opening and the pain upon opening, but my jaw was so severe. I mean, it's been locked shut since January that I know that's going to take time for me to have that improve. And I mean, most people that would be their worst symptom, but for me that's at the bottom of the list. You know, all the other stuff debilitated my life so much more than my jaw, so I'm more than willing to be patient, because if everything else is improving, I know that's just going to take time. So jaw pain at rest, at least an 80% improvement. Jaw pain at opening, that hasn't changed. So, and then the jaw opening has remained the same. I've been sleeping much better. I used to wake up anywhere from 4, 5, 6 times in a night. The last couple nights have been really good sleep for me. Last night I only woke up once, so I feel much more rested in the morning, which has also increased my energy level, which is great. And I've seen at least a 50% improvement in my energy level. I no longer wake up and want, like, internally go, I just wish I could go lay on the couch all day. One thing I did notice too, my shoulder pain has greatly improved. 100% change, yep. My balance, I've noticed at least an 80% change in that. I'm a lot more sturdy on my feet. I don't feel, when I walk or move around, like I could lose my balance and fall. But it's only been a week, so I'm excited to see what the next few weeks have to bring. Well, I think I'm probably about 40% improved overall, which is, you know, considering where I was, a very good improvement, you know, by my standards. The vertigo, which was probably the most hindering in life, anyone who's experienced knows how debilitating it can be. I've seen probably about a 50% improvement. I still have some days, but the days that I do have are milder. It has to go with my movements of my neck, you know, and stuff like that. So it's shorter lived and dissipates a lot faster. If I move wrong, it can last a little longer, but nothing, I'm not talking hours at a time, which is a huge improvement. I had to change the initial first week. It had gone down a little bit and changed some pitch. That unfortunately has gone back to what it was, and I haven't seen any additional improvement yet. but I'm very optimistic. That is probably one of the biggest improvements that I've had. It was horrible before, the sharp pains, and they were constant. And now I'm probably, at a 80% improvement with that. They're very random and very few and far between, and don't last quite as long when they do hit. Yeah, that's probably my best improvement. 95%. I used to wake up with them and had them all day, and they were constant. And I'm at least a 95% improvement. If I have one, it's maybe once a week now, versus before. So that's been a huge improvement in my life. So I haven't really seen much improvement in the jaw pain yet. I'm not surprised, considering how horrible it was and my limited opening. I know a lot of it has to still do with my clenching, a lot of muscular things that are going on. I am optimistic, just seeing improvements in other things. Coming into it, I really didn't know if it would work or not. I'd seen so many doctors, and my expectation coming in, I'd be happy with even just a 30% improvement. I'm sitting at 40% right now, and so I, at this point, am very optimistic. The more time that I give this, the more improvements that I'm going to make. I had not really had any improvement in my vertigo with the lowers, but once you did the uppers a month ago, this is the first time I haven't had vertigo like I had. I've had a few episodes where I don't even want to term it vertigo, or if I've turned my head, but it's very short-lived. It's like a few seconds and then it fades away, versus where I was before with vertigo lasting hours upon hours. 85 to 90%. I'm very optimistic. Give it another month, I'm sure I'll be at 100%. I'm so glad that I, move forward with phase 2. Because if I wouldn't have had, I'd still be dealing with the vertigo. It was at a point where it was almost, every other day, at least a few times a week. And this is the first weeks, to me, that I haven't had any spinning. It went down initially, the first week that the phase 1 went in. But then after that first week, it went back up to where it was. But interesting enough, after starting phase 2 with the uppers, it went back to where it was that first week when the phase 1 initially started. I probably had about a 30% change in the tinnitus, which for me was huge, because it wasn't your normal tinnitus. It was so loud, you hear it over lawnmowers, you hear it over movies. How I went this long sanely has just been a miracle. So even a 30% improvement for me is a huge improvement. That was better initially. I haven't noticed, I've noticed a little bit of an increase in it, but it's still much improved, from where I was initially. I'd say the right side is actually 100% improvement. I haven't had any pain in my right ear, but my left ear, which has always been my bad side, I've probably had about a 50% improvement, I would say, in the ear pain overall. Headaches are 100%. It's been so nice to not wake up every morning and have this headache, and it would last all day. So yeah, 100% on that one. Actually, that went away with phase 2 too. So I was having them after the phase 1, the fixed orthotic went in. It decreased tremendously with that as well, 70–80%. But I was still having them a few times a week. 1 or 2, sometimes 3 was usually my max. But since the top, the phase 2 started, these last 4 weeks, I haven't had any. It unfortunately hasn't changed, but it has nothing to do with this. It has to do with, the 3 previous surgeries, what we saw and learned from CTs before to CTs now. It was the surgeries that wrecked my joint. They removed everything, and so we figured out why I'm in this position with removing everything. I was just grinding bone on bone for almost a half a year, which wrecked the joint. And but I don't anticipate any improvement, from this, but that wasn't my number one symptom. Amazingly enough, it wasn't. So for me, I'm functional, and that's where I needed to be. I actually feel like I have a life again, you know. I can deal with that, and that will get fixed eventually. But I am so thankful and so grateful to have found you and made it here. I of course wish I would have made it sooner before the surgeries, because that really messed my joint up, but that's not the case, and I'm getting better now, and so I just got to move forward.
'Cause it shouldn't hurt to smile when your bite is aligned. You're feeling fine.